So which probiotic is right for you? How would I know if something's right for you? So different probiotics have been shown to affect different health conditions. And to me, it's choosing the right one is essential. So scientists, and we love one of the things with Dr. Nandi, our whole goal, at all the folks that work with us, we want to have science backing it, right? As much as possible. Not everywhere or not every single time can you have science backing it. We do everything we can to try to have science backing us. Hi everyone, Dr. Partha Nandi. Thank you for joining me today on our live, and again talking about gut health and probiotics. We talked about last week. For those of you who joined us, we talked about gut health and the microbiome. Should we all stay on probiotics, right? And I think lots of you thought that, hey, you know what? I'm not sure if this is right for me. So we're talking today a little bit more detail, right, about probiotics, and are they all the same? Is there any difference between one versus the other, right? Which probiotic is right for me, right? Talking about some of the probiotic strains that are there, and what kind of conditions can this help me with, right? So, do I want to have a great health plan to lose weight? And what about some recommendations about what type of probiotic? Something called CFUs. What the heck is that, right? And quality and label reading, all that stuff. So we know, hey, when you want probiotics, this is what you look for. So again, thank you all for joining me. Let us know where you're joining us from, and any questions that you have, please give it to us. We're going to answer them. But I want to get right to it, right, and ask, kind of give you some ideas about what's happening. So probiotics, good bugs. Now, probiotics are a friendly type of bacteria that provide health benefits. We think that there are, and those of you who have been kind of joining me every Tuesday at 5:30 approximately Eastern. I'm a little late today because I was in the hospital and could not get here on time. But typically it's 5:30 Eastern. You've been listening to us, and we're talking about gut health, and I talked about probiotics. Listen, are they all the same? How do I know, right, which ones to take and why today? So often probiotics, the good bugs, are taken as supplements. People take them as supplements, as health supplements. And you can take probiotics in multiple different ways. I talked about that last week. Capsules, powders, liquids. Sometimes you can take it with food, but we're talking about today we're talking more about, can you take them as a supplement in addition to food, right? Lots of kinds, many brands, different ingredients. So sometimes it's overwhelming. And I know if you go down, I was at what was that, Sam's Club the other day? There was a ton of probiotics, right? And you're lost because they all look great, they all look colorful, and really nobody really knows what the heck is going on because there is no guide for this. So I thought, hey, you know what? Let's provide some guidance, right? So which probiotic is right for you? How would I know if something's right for you? So different probiotics have been shown to affect different health conditions. And to me, it's choosing the right one is essential. So scientists, and we love one of the things with Dr. Nandi, our whole goal, at all the folks that work with us, we want to have science backing it, right? As much as possible. Not everywhere or not every single time can you have science backing it. We do everything we can to try to have science backing us. So scientists give bacteria 3 names, right? Important to understand this: genus, species, strain. You'll see something like Bifidobacterium longum W11, right? So Bifidobacterium is the genus, longum Longum is the species, W11 is the strain. It's important because you'll see this stuff on the label and like, what the heck is that? So that's what's important. This matters. Why? Because scientists research how well probiotics work for a health condition, and they use a specific type, right? So the genus, species, and strain. So when you're choosing a probiotic, make sure that all 3 names are on there as much as you can. Also, remember, when you're taking a probiotic, if you're taking it for general health, great. But some people want to take it for a specific condition. Try to understand, research the condition as much as possible. If you go to AskDrNandy.com, we often have lots of ideas about certain types of diseases or probiotics good for that or not, you may be able to check it out and see if it's useful for you, right? It may be. So I welcome you to do that. So ideally, look for a product that's been tested for whatever you're trying to address. It may not be, right? You may have a condition that may not have been tested. Do your best in this. So know that different strains of the same species may be different and could have different effects on health. Some of the best probiotics, I talked about this last Tuesday as well, some of the best probiotic strains for health, and they've been studied well, as Lactobacillus, right? We're talking about the general, what is that? The general genus, right? We're talking about Lactobacillus, and you'll see Lactobacillus acidophilus, right? This balances potentially harmful bugs that can otherwise grow, overwhelm in your gut due to illness or antibiotics. Lactobacillus, also fermentum, strengthens your immune system and prevents gastrointestinal and upper respiratory infections. Important. Lactobacillus plantarum stimulates your digestive system. I am all for that, right? You see my label here, wherever it is. Gastroenterologist, I love that. Stimulates your digestive system, fights off disease causing bugs. Super important, right? Super important. These are important things to remember. What I love about these lives, they stay on. If you're taking notes, it's great. If you're not, listen, it'll replay. So after the live, if you want to have some questions, you can replay it to remember that. And it should be transcribed, so that's nice as well. What about some common health conditions that probiotics can help? Weight loss, right? Studies have found what? That certain strains, right? Certain strains of Lactobacillus family can help you to lose weight and belly fat. Woohoo! Right? People are buying stuff today, right now, as we speak, about some miracle cure for God knows what, for belly fat. So remember, there are some studies that show that that you can actually be able to lose weight and belly fat. Some people want to get in their I don't know, bikini bodies, which is fine, but also for your health, overall health. When you have weight loss and you have good healthy weight, it can also help diseases like diabetes, high blood pressure, lots of conditions, including malignancies as well. If you have a healthy weight, it can help. Lactobacillus gasseri has been shown some of the most promising effects on weight loss. One study, in fact, 210 folks with significant amounts of belly fat showed that this Lactobacillus species for 12 weeks reduced body weight, fat around organs. Really important, not just what you see. You may see some people that look great on the outside, but they may have fat around the organs, right? Decrease something called body mass index, waist size, and hip circumference. Very important. Belly fat itself was reduced by 8.5%. When they stop taking the probiotic, here's the cool thing about studies, right? You have to see if it's an association or possibly there's a cause and effect. Once they stopped taking these probiotics, guess what? They gained all of the belly fat back in 1 month. That's pretty cool. I mean, to me, it's not cool to gain the weight back, obviously, but it's cool that you can see some interesting patterns here. So, I think that it's important to talk about, I think it's important to talk about the evidence, right? And so I think that when you are doing this research, remember that some of this is been studied. You don't have to reinvent the wheel. Look at it, and we can find out. How about depression and anxiety? I think, to me, we have a crisis of anxiety and depression. I mean, listen, all around the world, right? You have really, really important things going on that can wreak havoc in your lives, right? Whether it's thousands of miles away in Ukraine or something that just happened down the street. Anxiety, depression is there, and even coping with some of the everyday stresses. I was driving this morning in Michigan. We call it Welcome to Spring. It was like at 30 degrees and ice, right? People were driving like crazy. Does that cause stress and anxiety? And here's what we found. Probiotic strains Lactobacillus helveticus and Bifidobacterium longum have been shown to reduce symptoms of anxiety and depression in people with clinical depression, not episodic depression or anxiety. But to me, that's amazing. What about diarrhea? Lots of people, right? A patient of mine called me because they're having diarrhea after taking antibiotics. Guess what? They have, you can see Lactobacillus species Rhamnosus GG and Saccharomyces boulardii have been shown to reduce the risk of AAD. The names are important. You can look them up, but it's important to know there's science behind it. To me, that's awesome. It brings out the geek in me, but it really shows you, because right now lots of people talk about lots of things and they really don't have basis for it, right? But we're trying to give you basis, fact-based, science-based stuff that really can help you. So that's what's important. How about irritable bowel syndrome? Probably the number 2 reason why people come and see me as a gastroenterologist, irritable bowel syndrome. Lactobacillus and bifidobacterium have been shown to potentially restore some of the missing microbiome functionality and help manage IBS symptoms. It's not an end-all, it's not the only thing, but it really can help to make a difference. So I think that a general recommendation, right? Again, thank you all for joining us on this live. I know you could be doing. I'll use a Jay-Z line. Jay-Z is one of my favorite rappers. He goes, "You could be anywhere tonight, but you're here with me. So thank you." So I appreciate you guys taking the time out of your busy days to be able to join us. And if you think this is important, please share this with your community. My team will also put in the link a superfoods cookbook. I think it's fantastic. It really gives you a way to really proliferate your probiotics, right? To give good prebiotics, good stuff that can really help you. So I encourage all of you to do that. And again, thank you for joining us. I appreciate you guys telling me where you're from and giving us your questions. That's fantastic. Gives us an understanding of where we should study more, where we should do more research. General recommendation, back to the topic, is to choose probiotic products containing, again, the genus Lactobacillus, bifidobacterium, and Saccharomyces. Again, I'll say it again. Choose a probiotic product. General rule of thumb, right? Containing the genus Lactobacillus, bifidobacterium, or Saccharomyces, because they've just been studied way more often than others. Look for products with at least 1 billion, right? 1 billion colony forming units. You'll see like people that all kinds, but at least 1 billion colony forming units. Colony forming units, or CFUs, tells you how much bacteria you're getting in each dose. How much you need really is variable, right? Depending on what you want to treat. No general rule to follow. You typically want at least one, right? But 1 to 10 billion with the B CFUs that you take once or twice a day. And if you don't get enough of the colony forming units, you may not get the results that you want. You may be disappointed. And that's what's important to know, that if you don't do that, you may be disappointed, right? Know always also that not getting a bunch more is better, right? It can actually give you some side effects. Some of my patients get bloated, uncomfortable if they take too much, right? And one of the things that's really important, this is something you should really pay attention to. On the labels, some manufacturers list CFU at the time of manufacturing, right? It's important to know what you're getting before the product expires. If you're not sure what the count tells you, you should get in touch with the manufacturer. Very important. Keep in mind, right, that the CFU listed is usually the total for all the probiotic types in the product. You may have more than one probiotic type. So let's say you have a lactobacillus product and you have a bifidobacterium and you have, the whole total colony units is 20. It may be that each one of those is 10. So remember, it's typically listed for all the probiotic types. Remember, quality is important. Your probiotics are sold as supplements, just like vitamins and herbs. So important. The FDA does not check them for safety or health claims made by the maker. Very important, right? FDA does not check them for safety or health claims. And the way they would for drugs. Choose a brand that you can trust, right? Actually, in one study, 5 out of 19 probiotics had lower counts of the CFUs than listed on their labels. So you can do your research and see which brands get high grades. In the future, we'll try to curate that for you a little bit more. And you can ask your healthcare provider, your doctor, for suggestions. Read the label. I tell my kids this, right? When you're having food, you got to read the label, because if you don't read the label, you're lost, right? You really are getting lost. So when you read the label, it'll tell you the CFU. It'll tell you the strains. Look at the dose. It'll tell you how much to take to get results. And it'll tell you how you store it. Some need to be in the fridge, and some can be, in regular room temperature. Heat dried formulas should be kept in the fridge, while freeze dried ones can handle room temperature. Heat dried, fridge, freeze dried, room temperature. And make sure the place you're buying it from, right? In the store, make sure that you're buying it, right, in the way that it's supposed to be. So it's important to know that. If it's in the fridge, let's keep it in the fridge. Also look for other ingredients. Make sure in the probiotic, make sure everything there is safe, that you're not buying some additives that are not safe for you. And check the use by or expiration date. Very important, because remember, these are all often live organisms, right? The amount of CFUs may go down as your product gets older. So appreciate it. Hey, thanks everybody for joining me. I just want to give a quick shout out to everybody who's joining us. Let us know where you're joining us from. Any questions you have. Terrific stuff. Thank you for joining me. Let me keep going, right? Make sure that these probiotics are safe for you. For most people in good health, probiotics, awesome, no problem, very well tolerated. But if you do get side effects, typically mild, and it could go away over time. You can get some bloating or gas more than usual. Use caution if you have a serious health condition or if your immune system is not normal, right? If it's weaker. And regulations also differ amongst probiotics, so you must be cautious when choosing a product. But the cool thing is that probiotics have a lot of promise, right? That it can work, but it doesn't mean it works for everybody. Like everything else, it may not work for you. So don't be disheartened if it doesn't, right? And everybody's gut microbiome is a little different. Don't stop any medical treatment you're already getting because you're trying a probiotic. Once you start, though, give it a month to see if it works for you. Remember, you got trillions of bugs in your intestinal system, and these are just billions. So it's going to take a while for it to shift over. Excuse me. But it's important to know that. So it's not going to be that you're going to, in 3 days, see a difference. Give it a good month. So takeaways, right? Partha's prescriptions, I call it. Bottom line, Partha's prescriptions. Maintaining a healthy gut is more than just taking a probiotic supplement. We've got the Superfoods cookbook we've given to you. Please take a look at that. It's super important to get some of these in your food. Diet, exercise, just as important as many lifestyle factors. Thank you. Affect your gut bacteria. If you're interested in improving your health in your gut, probiotics, to me, is absolutely worth a try, right? I tell a lot of my patients who have diseases in their gut that they should try it because it can be a game changer for some people. Be cautious. Remember, like with anything else, use a reputable product, look at your label, start slowly, and make sure your doctor or healthcare provider knows what the heck is going on. So I really appreciate it. I'm going to say some quick highs to everybody. Christine Sutherland, thank you from Port St. Lucie. I appreciate you joining us almost every Tuesday. Appreciate that. Regina Mills, how do you get rid of inflammation? Probiotics and your diet with superfoods will be one of the first steps. But we will definitely, please inbox us. Give us your email address. We'll give you some information as well to my team. So Regina, if we can get her email, and we will get some information to you. And Denise Phillips from Macomb, Michigan. Hi, Denise. And AC Nina Nanison from Halmstad, Sweden. Thank you. Josephine Ertel. And then, let's see, Ismeta Mulik Jusfovic. That's a great name. I'm sorry if I'm mispronouncing it. Hello from San Diego, where it's beautiful and 80 degrees, right? And Ashley Jade Catting says, what is the best yogurt? I like Fahe. I use that all the time. I use the non-fat or low-fat, really beautiful. And what I do is I pick different fruits every single day. I'll put berries one day. I'll put strawberries other days. I'll eat bananas. To me, variety is really important, right? It's important to have fruits and vegetables, but have a variety so you can then couple your yogurt with that. You're getting your own natural probiotic, but then also get some fruits and vegetables. Get some additives with it, and that way you're getting not added sugar. So that's my choice, and that's my recommendation actually for you. Cindy Zwick from Warren, Michigan. You're actually one of my doctors, so thank you so much for being one of my wonderful patients. Then Oren Goodman, hello again from Toronto. Oren joins us every week. It's awesome. Elke Stevens says, can you address why some are refrigerated and some not. And I talked about that, right? It just depends on how they are created, right? How when some things are created in one way versus another, that's how you know which ones to get. Remember, if you get it right, if you get it from a store where there's the refrigerated, stay with it. It just depends on how these are created and how they're stored. So very important to know that. Let's keep going here. I'm looking. Jerry Pugh, thank you so much for joining us. Salani Munyanye from South Africa, awesome country. Thank you for joining us. And Suzanne Mutolwa from Zambia. Hannah Miranda from the west side of Detroit. Thank you so much for joining us. And Michelle Tool, should we get a stool test? I think that may be useful. I'll talk about this in future lives. And Michelle's asking a very important question because, hey, is it important for us to really know what our microbiome's like? There are some tests out there, right, that talk about, hey, what is our microbiome made of? And I think it's important. And I think it would be helpful to get stool tests for sure. Randy Marshall Donahue, validity of functional stool tests. It's a little different question. Sometimes, it depends on the manufacturer. Please give us your email. We'll give you some information about that for sure. And then Randy Marshall said, who should avoid Sibo sufferers? I think in the beginning, right, when you're treating Sibo, Randy, I would not put a bunch of probiotics in there, right? Once you treat Sibo, we can start to use some of the good bugs to be able to help you. But in the beginning, absolutely not. Can you type these words out and which is best for what? Absolutely. This will be transcribed, Cindy, so you can get it. Cindy says, can you type these words out and which is best for what? Kim just sorry if I'm mispronouncing it. So many choices. Will you be sharing brand recommendations? I will. What I want to do first is to just give you a mindset about what is it that we're talking about, right? Kind of big ideas. Then we can get down to the brands for sure. Callie Nandi says, thanks for working so hard. You've had a monster week. Thank you so much. Callie is such a rock. She always, she's amazing. Cindy says, can you eat too many fruits in a day? I think that depends, right? For most healthy folks, yes. For some diabetics, certain fruits are probably not great for you because of the glycemic index. In other words, GLYCEMIC. And in our Superfoods Cookbook, we'll give you some recommendations on low glycemic index. But yeah, you can, right? You can get too much fruits for different health conditions. But in general, for people that are healthy, it should be fine. Go for it. And Guy Kaler from Oxford, thank you so much for joining us. And you talk about gut brain, Cindy Zwick says, which probiotics will help with brain fog, memory, and overall function? I think Lactobacillus and Bifidobacterium will definitely help. I'll talk about that specifically in a future live for sure. I will be back. I'll tell you, I will be back next week. And I want to talk about an important topic. A lot of my patients are asking me, right, about what is it that COVID is doing. So many of my patients have been suffering from COVID and it's affecting their gut. I'd like to talk about the gut and how COVID affects the gut next week at 5:30. So the COVID and the gut, what's the connection, right? This is a bug that's affecting your lungs, right? Affecting your respiratory system, but so many complaints about the gut. And can we make any connection? So I'll talk about that next week. Hey, thank you so much, guys, for joining me. I'm sorry I was a little bit tardy today. I was couldn't get back from seeing some of my patients in time. So I appreciate you joining us. And remember, make healthy living, right, a part of your everyday. Be a health hero. Thanks so much. Namaste as always. Appreciate it. Hi everyone, I'm Dr. Partha Nandi. And if you enjoyed that video, you're going to love the next one. It's full of incredible information to help you start your health hero journey.